Hi friends, today we are going to discuss penicillins. Penicillin is a very important group of drugs which are used again as an antimicrobial. So let's see first of all the classification of the penicillin. So this is the classification of the penicillin. Penicillins are classified into two types. First one natural penicillin and second one semi-synthetic penicillin. The example of the natural penicillin are penicillin G, procaine penicillin G and benzathine penicillin G. Then semi-synthetic penicillin are further divided into three groups. The first one acid resistant penicillin, the second one penicillinase resistant penicillin, and the third one extended spectrum penicillin. Example of the first one is phenoxymethyl penicillin, that is penicillin V. The example of the second penicillinase resistant penicillin is methicillin, oxacillin and cloxacillin. Then extended spectrum penicillin are further divided into three categories. First one aminopenicillin, second one carboxypenicillin and third one uridopenicillin. The example of the aminopenicillin is ampicillin and amoxicillin. Then the example of the carboxypenicillin is carbenicillin and tacarcillin. Then the example of the uridopenicillin is mexocillin and piperacillin. So this is the classification of the penicillins. After classification, we will discuss the mechanism of action. First of all, the penicillin will be working by the mechanism of action that it will inhibit the formation of the cell wall synthesis of the microorganism and do not let it to grow in such a manner that it can cause a disease. First of all, cell wall will be formed by the NAM and NAG, that is N-acetylmuramic acid and N-acetylglucosamine. There is a chain of the NAG and NAM, something like this. Then there is a deadenine chain and to the deadenine chain glycine chain is also attached, and the adjacent chain of the NAG and NAM will form a cross link between them. This you can see the cross linking, and that cross linking will be formed by the transpeptidase. That transpeptidase will help for the cross linking of the chain between the two adjacent strands. So if we use the penicillin or any kind of beta lactam antibiotic of group of drug, they will inhibit that transpeptidase and the cross linking between the adjacent peptide of the NAG and NAM. The cell wall will not form and the bacteria can't grow. This is the way penicillin will work. The beta lactam structural analog of the D analog inhibit the transpeptidase and thus inhibit the cross linking of the peptidoglycan, as we see, and cell wall synthesis. Thus the bactericidal effect is seen. So this is the mechanism of action of the penicillin. The adverse drug reaction are: first one hypersensitivity reaction, IgE mediated type 1 hypersensitivity reaction is seen in the penicillin, which will cause skin rashes, urticaria, itching and dermatitis. Then bronchospasm and angioedema, joint pain, serum sickness or anaphylactic reaction. And prolonged use of penicillin G will cause the thrombophlebitis. Then Jarisch-Hessner reaction is one of the peculiar adverse drug reaction of the penicillin, that in this reaction there is an exacerbation of the sign and symptom of the syphilis, that there is very severe signs of syphilis is seen during the penicillin treatment. Then fever, chills and myalgia will be there, and hypotension, circulatory collapse is also seen. So these are the adverse drug reaction of the penicillins. After adverse drug reaction, we will see the therapeutic uses of the penicillin. As we are following the same pattern or the same sequence of the uses of cotrimoxazole, then we see fluoroquinolone and now penicillin. The first three are urinary tract infection, respiratory tract infection and GI tract infection. In urinary tract infection, it will cause pyelonephritis. In respiratory tract infection, it will cause diphtheria. In GI tract infection, it will cause bacillary dysentery. Then the third group, that is the second group of three, that is STD, it will cause syphilis, then gonococcal infection and meningococcal infection causing meningitis. So these are the six. Then after that, the third group, we have seen nocardiosis, chancroids and typhoid fever in the cotrimoxazole and fluoroquinolone. There is a slight change in the penicillin, that nocardiosis and chancroids are not included in the uses of penicillin. Instead, only we will use the typhoid fever only. So these are the repetitive uses of the cotrimoxazole, fluoroquinolone, penicillin, same. After that, the peculiar uses of the penicillin are streptococcal infection in pharyngitis, sinusitis, otitis media, and bronchitis. Also in the rheumatic fever, the regimen or the dose of the rheumatic fever can be asked sometime. It is also given in a Balani. So I have written is that benzathine penicillin G is given 12 lakh units in a single dose once month intramuscular lifetime, and procaine penicillin G 6 lakh unit intramuscular once daily for the 10 days. This is the dose of the penicillin in case of rheumatic fever. Then clostridial infection like tetanus and gas gangrene, and leptospirosis, anthrax, Lyme disease, and actinomycosis, rat bite fever, and H. pylori infection. These are the some diseases in which we can use the penicillin as a drug of choice or the drug. So this is the way we can remember the first three, second three, and the next group, and after that some peculiar diseases. If you have followed the cotrimoxazole and fluoroquinolone sequence, then you will find it very easy to remember the uses of the penicillin. So this is the way uses, adverse drug reaction, mechanism of action, and classification. Now it's up to you to write it in a well organized and systematic manner in your exam. You can write the classification as it is. Then in the mechanism of action, don't write something like this. I just give you overview that something that structure is present and cross-linking will be formed between the adjacent strand. That cross-linking will be given by the transpeptidase, and our drug, that is penicillin, which inhibit that transpeptidase enzyme, and due to this cross-linking will not happen, and if the cross-linking will not happen, cell wall of the microorganism will not form and microorganism can't survive. This is the way mechanism of action of the penicillin is. You have to write in a detailed proper theoretical format in your exam. Adverse drug reaction, you can write something like this, and then the therapeutic uses as it is. Just mention some detail about the disease, that is the pyelonephritis, diphtheria, bacillus dysentery, syphilis, all other. By this way you can frame your answer in a well organized systematic manner that will be beneficial for you to fetch the marks in your theoretical exam. So this is the sequence you have to follow. Same, the classification, then the mechanism of action, then adverse drug reaction, then the therapeutic uses, then extra you are knowing that something, if you want to write anything about it, that your contraindication, maybe indications, or whatever you want to write, you can write. So format the answer in a well organized form. Thank you so much.